Good afternoon, ladies and gentlemen, and thank you for waiting. All lines have been placed on listen-only mode, and the floor will be open for your questions and comments following the presentation. Without further ado, it is my pleasure to turn the floor over to your host, Ms. Erica Morrison. Ms. Morrison, the floor is yours.
Thank you, Brad. Good afternoon, and welcome to the Kickoff and Learning Session 1 for Maryland, Virginia Nursing Home Improvement Network. My name is Erica Morrison, and I am the Learning and Action Network Manager at NHQCC. Before we get started, I have a few housekeeping items to share. First, today's session will be recorded. The recording will be emailed to the registrant list and will be posted on our website in just a few days. Next, we want you to be aware of the features of this webinar to be able to answer and ask questions. During the webinar, we will have some polling questions that will appear on your WebEx screen, so please participate with us when those come up. During the Q&A portion at the end of the webinar, the operator will provide instructions on how to ask a question. You may also use the chat function if you see on your screen to send your questions. You may access chat by clicking on the chat icon in the middle of your screen on the WebEx. We will follow up on any questions that are not answered during our time together. Things to think about. During today's webinar, I encourage you to commit to being attentive and engaged, open and collaborative and actionable. Throughout the webinar, again, we will ask questions of your team through polling, and we would really like for you to participate so that we can learn about you and your needs, and also so that you can learn about others in the network. So first, in terms of our agenda, I will be providing a brief overview of NNHQCC and then share details of the Maryland, Virginia Nursing Home Improvement Network. But first, we would like to get to know you, to know our audience, by asking you just a couple of questions. Our WebEx host will post the first question in just a moment, which is, in what state is your nursing home located? The choices are A, Maryland, B, Virginia, or C, both. If you're representing a corporation that may have nursing homes in both states, we encourage you to select that answer. So as you can see, Emily has posted the polling questions. We'll just give folks a moment to answer the question and click submit at the bottom right of the screen. The results of the polling will come up just shortly as folks answer the question. The poll has ended and the results will be coming up. And just as a reminder, if you haven't put your phone on mute already, we encourage you to do so. We can hear just a little bit of background noise. Okay, the results are up. It looks like we have 25 participating in Maryland, about 10 in Virginia, and just one or so representing both. We know that this is the beginning of the webinar, so we'll have other folks joining us shortly, but that's good to know who is with us currently. All right. We have another polling question for you. Our next question is, what role best describes yourself and those in the room with you? The answer choices are A, administrator, B, director of nursing, C, QA or QI nurse, D, director of staff development, E, licensed nurse, F, direct caregiver, G, physician, or H, other. I see the question is up on the right-hand side of your screen. You take a moment and select all that apply. I know there's maybe more than one person in the room. Just a few moments while answers are being selected, and be sure to select the submit button at the bottom right-hand corner. And we will be getting the answers in just a moment. All right, the poll has ended. Take just a moment for WebEx to collect the answers. We hope that you were able to combine some staff today and get them in the room, but we know that can be difficult. But look, it looks like we have the answers up, and we have administrators and directors of nursing tying the poll here, and several QA, QI nurses, and a good amount of other staff, and we do appreciate your time. We know that your time is very valuable, so thank you for being on the call with us. So again, thank you for sharing who has joined us today. Just a little bit about us as NNHQCC. We are a private nonprofit healthcare consulting company that has served as a QIO for the state of Virginia for over 30 years. But because of a recent regionalization, we are excited about the opportunity to now serve as the Quality Innovation Network QIO for Maryland and Virginia. You may hear me refer to the Quality Innovation Network QIO as the QUIN QIO throughout this presentation. So the NNHQCC consultants come from a wide variety of healthcare backgrounds. Our experienced team members may include hospital executives, nursing home administrators, physician practice managers, nurses, HIP managers, health communicators, physicians, and pharmacists. And building on our QIO experience in electronic health record adoption, data reporting, and care coordination, we also serve as Virginia's statewide regional health IT extension center. Our counterpart in Maryland is CRISP. So I've introduced myself earlier in the presentation. At this time, I would like to introduce you to the rest of our NNHQCC team members for the Maryland Virginia Nursing Home Improvement Network. Harold Hansen and David Hall are improvement consultants in nursing homes in Maryland and Virginia, respectively. Sheila McLean and Marcy Gillespie support their work as program directors in each state as well. So I'm happy to hand the call over at this time to improvement consultant David Hall to introduce the goals of the Maryland Virginia Nursing Home Improvement Network. Thank you, David.
Thank you, Erica. And then we'll spend the next few minutes reviewing the details of the Maryland Virginia Nursing Home Improvement Network. As the QI and QIO for the states of Maryland and Virginia, NNHQCC is pleased to kick off the Nursing Home Improvement Network today. Currently, about 35% of nursing homes in Maryland and in Virginia have signed up to participate in our network. By the end of our work together, over 75% of nursing homes in each state will be participating with UNS to test systems of change and organizational and clinical areas, and benefiting from the collaboration, resources, and goals of this network. The overall goals of the network are to decrease antipsychotic medication use and to achieve an initial relative improvement rate of 3% by July 2016, and to decrease potentially avoidable hospitalizations, to increase mobility of long-stay residents, and to achieve a score of 6 or less on the National Nursing Home Composite score. It's worth mentioning that goal number 3 is still under development by CMS, so we'll be hearing more about the specifics of it at a later date. And we'll be discussing goal number 4 in detail in the next few slides. So what is the nursing home composite measure? The composite measure monitors progress at the national, at the QUIN, QIO, and nursing home level. Nursing homes participating in the improvement network focus on processes that improve their systems and measure individual tests of change. Specifically, they look at their plan, do, study, or PDSA improvement cycles, look at clinical outcomes and measures, and composite scores. The composite score is not intended to replace or supersede existing local or federal initiatives, including the 5-star rating system, but is offered as another way to look at quality from the system's perspective. There is a formula to calculate the score across all 13 measures to determine the composite score. The goal of 6 or less was established because nearly 2% of the nation's nursing homes have achieved a composite score of 6 or less, so that was established as the benchmark. On this slide, I listed the 13 National Quality Forum endorsed measures that make up the composite score. You will see that these measures align with several CMS focus areas and also align within the goals of the network. They're decreasing HIAs and other healthcare required conditions, decreasing mobility, decreasing the use of antipsychotics, and decreasing potentially avoidable hospitalizations. NHQCC receives this information directly from the CASPER data reports, and as part of your participation in the network, we will pull your facility's data into graphs and share them with you to support your QI activities. In addition to working on these goals of the network, facilities will also have the opportunity and flexibility to choose from additional QI topics, such as staff stability, consistent assignment, and team building, and decreasing health-associated infections and other healthcare required conditions such as pressure ulcers, UTIs, and CVS.
Thank you, David. At this time, we appreciate hearing about the topics that you're most interested in addressing. We have another polling question for you to consider. What are the opportunities for improvement at your nursing home? So feel free to select all answers that may apply. As Emily brings up this polling question, I'll read the answer choices. Those are A, reducing antipsychotic medications, B, avoidable hospitalizations, C, CDIS, D, consistent assignment, E, mobility, F, pressure ulcers, G, staff stability, H, team building, and I, UTIs, and there's also J for other. The polling question is up, so if you haven't already selected an answer or any multiple answers if you want, please go ahead and do so and click the submit button. And if you did select other, it will be really interesting to see what those things are. So if you selected other, please take a minute to drop into chat what that other may be. Okay, looks like the poll has ended, and WebEx is collecting the responses, so just shortly we'll be able to see what those are. Okay, here we go. It looks like antipsychotic medications is leading the pack, but right ahead of avoidable hospitalizations and team building. We have a few for UTIs, and then followed by information on actually staff stability and UTIs and looks like pressure ulcers and mobility. And certainly these topics are ones that we all have been working on throughout the years, and so it's really good to see what the choices are. Let me go back to chat to see if we had any responses dropped in for other, and it looks like pain control has been listed several times, and as well as stewardship. So that's wonderful. Thank you so much for providing those additional topic ideas. And that's in terms of what we are doing here in the Nursing Home Improvement Network. How do we plan on accomplishing these goals and addressing these topics? We will be using a collaborative approach between nursing facility providers, quality improvement consultants, and states. NHQCC will provide and facilitate opportunities for nursing homes to share best practices. High-performing nursing homes will have an opportunity to serve as peer mentors. You will actually meet two of our peer mentor nursing homes in just a moment. Also, QI principles and techniques along with topic-specific education will be offered in the form of webinars and workshops. And additionally, providers will have access to an online community platform that provides improvement resources. Also, providers will receive a CMS change package, which includes ideas and proven strategies to test in your facility. Participants will conduct Plan to Study Act cycles to test those improvement strategies. And additionally, the network offers group sharing of what works to improve resident care. And of course, as participating nursing homes, you will have access to NHQCC's consultants to help with your transformation as well. The Maryland, Virginia Nursing Home Improvement Network is designed to align with existing improvement efforts so that we can be effective and efficient in helping you to reach your goals without adding to your burden. So what are the components of the Nursing Home Improvement Network? First, we will take, and I'll teach, all-learn approach, where we all impart knowledge to each other and we all acquire knowledge from each other. Secondly, and within the Nursing Home Improvement Network, there are two collaborative periods that are based on the National Nursing Home Quality Care Collaborative. The first collaborative, as you see, runs from April 2015 to September 2016, and the second runs from April 2017 through September 2018. The first collaborative, which is being officially kicked off right now, focuses on nursing home systems improvement, including mobility and antipsychotic medication improvement, and improving the nursing home composite measure score. More detail on this first collaborative will be provided in just a few minutes, so we'll go through some of the detail there. The second collaborative that runs in 2017 and 2018 will give nursing homes opportunities to focus on making and sustaining their improvements. So just going to give you a little more information about the National Nursing Home Quality Care Collaborative. This national collaborative is modeled after the Institute for Healthcare Improvement Breakthrough Series approach and is being led by CMS and QINs throughout the nation to rapidly spread the practices of high-performing nursing homes to every nursing home in the country. The aim here is to ensure that every nursing home resident receives the highest quality of care. Specifically, the National Collaborative exists alongside the Maryland, Virginia Nursing Home Improvement Network to instill quality and performance improvement practices and to accomplish the goals that we mentioned earlier of our network. A third component of the Maryland, Virginia Nursing Home Improvement Network is our online community. The online community provides a 24/7 location for you to engage with other nursing home providers that are in the Nursing Home Improvement Network, with NNHQCC improvement consultants as well as our expert faculty and peer mentors. We encourage you to join today and post a picture of your nursing home team. An online community tip sheet is available at this link and will give you directions on how to join the community and get the most out of this virtual resource. The fourth component of the Nursing Home Improvement Network is our panel of expert faculty, our VHQC improvement consultants, as well as our nursing home peer mentors. I'm very pleased to introduce our faculty experts for the Nursing Home Improvement Network. They are Sue Crehan. Sue is a certified wound and ostomy nurse. She has worked in multiple healthcare settings, including acute care, outpatient, long-term care, and research. Mary Childs. Mary is the founder of Childs Healthcare Consulting. Mary shares her expertise in quality assurance and improvement, performance standards, survey processes, resident care, assessment, and care planning. Sonia Varsness. Sonia has joined us actually today in the office. She's sitting right across the table from me. And Sonia is a master's prepared gerontologist with experience in aging, primarily in dementia and long-term care. She is currently a consultant and principal of Sonia Varsness Consulting. As a consultant, she works with organizations to operationalize person-centered values through education, evaluation, and practice. Thank you, Sonia, for being with us today. Dr. Coletti is a licensed clinical psychologist and president of Chapman Senior Care. Chapman Senior Care clinicians have been helping with the mental health needs of geriatric clients of long-term care facilities since '97. They consist of approximately 40 psychologists and licensed clinical social workers who serve as clients at nursing homes and assisted living facilities. You will be hearing from our expert faculty at webinars, at meetings, and through the online community. So we are very excited and honored to have them aboard. We are also very pleased to introduce our Nursing Home Improvement Network Peer Mentors. Peer Mentor nursing homes were selected in each state based on their ranking in the top 10% of nursing homes in the nation based on the CMS Nursing Home Quality Composite Measure Score. Peer Mentor nursing homes selected staff and resident or family peer mentors to participate as resources to you in this network. Longview Nursing Home is our peer mentor in Maryland. Donna Wilhelm and her team of staff peer mentors will be sharing a brief improvement story with you in just a moment. We are happy to introduce their family peer mentors, the Kelly family, who are pictured in this slide. Next, in Virginia, we are pleased to introduce the Woodview in South Boston as the Nursing Home Improvement Network Peer Mentor. Connie Zamora and Wanda Scott are serving as staff peer mentors, and we are thrilled to have Lynn Marshall-Crow to serve as the family peer mentor there. Connie and Lynn are pictured in this slide at the bottom left. Throughout the duration of the Nursing Home Improvement Network, there will be opportunities for other nursing homes to serve as peer mentors as well, so you may be hearing from us in the future. As mentioned earlier, the first national collaborative period within the Nursing Home Improvement Network is from April 2015, which is now, of course, until September 2016. It's a marathon, not a sprint, is the theme of this collaborative. You know, whether you're a marathoner, occasional weekend jogger, or you can just appreciate those activities, you know that building strength and the mental resilience to continue your journey takes time and effort. By way of a little story, my 72-year-old retired neighbor runs several miles every week. And honestly, as he tells me, they may be pretty slow miles if held to certain standards, but he knows that he can run far distances and stay focused for quite some time. He says he runs to gain discipline, he runs to accomplish personal goals. And I think there is a sense of a parallel there that improving the quality of care in the nursing home can be likened to that of a marathon and not a sprint. For just a couple of minutes, I'm going to review the collaborative structure and timeline and just the main change package resource that is available to you. The collaborative structure of the first collaborative period within the Nursing Home Improvement Network is based on the Institute for Healthcare Improvement Collaborative Breakthrough Series. Sharing calls and webinars, known as water stations and checkpoints for us, are combined with learning sessions and action periods to create a learning system where we learn from each other and from experts topic areas where we want to make improvements. This grid on the slide shows some dates and periods for activities within our first collaborative. We will be providing a collaborative guide to give more detailed information along with the dates that are mentioned here. Please take note and mark your calendar for most third Wednesdays from 12 to 1 p.m. We're hoping that that lunchtime period might afford you opportunities to participate. The action periods that are shown provide time in which to test your interventions or changes that you may choose to make in your facility. CMS has recently provided an updated change package resource for the National Nursing Home Quality Care Collaborative. We will be using this resource within our Maryland, Virginia Nursing Home Improvement Network. We've posted it to our online community, and it can also be found on CMS's website. The change package focuses on the successful practices of high-performing nursing homes and provides strategies and change concepts, as well as action steps that you can take as you make improvement in your nursing home. They particularly focus on decreasing unnecessary antibiotic medications. On decreasing unnecessary antipsychotic medications, long-term care mobility, and preventing HAI. At this time, I'm going to hand the call over to Improvement Consultant Harold Hansen. Harold will discuss improvement and then share the floor with our Maryland peer mentor, the Longview Nursing Home in Manchester, Maryland. Harold?
Thanks, Erica. Remember, when you signed up for our Nursing Home Improvement Network, you joined the Breakthrough Series collaboration. We found this Institute for Healthcare Improvement, MFI, an excellent systematic system, providing you the tools and the foundation you need for doing TI work and delivering rapid improvements to your organization. As you can see here, there are several key components divided into two main sections. As a collaborative, the aims are actually given and guide our work. Those are develop and use systematic processes like QAPI to guide improvement, prevent HAIs and other health-acquired conditions like falls and pressure ulcers, dramatically improve resident satisfaction by focusing on systems and the 13 quality measures we showed you before, so that your composite scores can become less than or equal to 6. And each of you will address all three of these simultaneously because they're actually interrelated, and a change in one will touch the other. An important distinction of the Breakthrough Series collaborative is consensus building is not actually needed. And I bet you never thought you'd hear that while looking at a PDSA diagram. But unlike most PDSA systems where consensus and buy-in are critical but time-consuming steps to move forward, consensus is not needed here because your PDSA improvement cycles are actually testing proven best practices or expert recommendations. So you're just tailoring these for your specific situation. And the PDSA cycle still provides structure. And you can test your ideas, goals, or even hunches to accomplish small aims using small tasks, thinking along the lines of, what can I do by next Tuesday? These small steps will actually cause improvements and magnify over each cycle of that PDSA. And as we all know, improvement does require change, but not all change is improvement. So measurement is required. It's critical to ensure changes result in positive outcomes or processes. The model for improvement mentions QAPI. We're talking about a proactive, systematic, data-driven approach to improve your residents' quality of life, the care, and the services you provide. You can see QAPI is not new. You can find these proven performance improvement approaches in hospitals, transplant programs, hospice, and dialysis center, as well as other services like service industries and even in manufacturing. QAPI adds performance improvement to your existing QAA program. It supports person-centered care by engaging residents and families. It defines quality as how your work is done. Finally, it helps to establish systems thinking by implementing proactive analysis through data measurement and processes and utilization of systematic tools and resources. Think about the top 10 nursing home deficiencies like hazards and infection control, not providing necessary care or sanitary food handling, comprehensive care plans, meeting professional standards, clinical records, screening employees, medications, lack of dignity or person-centered care. These various approaches or various deficiencies or various survey sightings include your entire organization. So who has eyes on these common survey sightings? Not just caregivers or management, Who can actually fix them? Management has the resources and money. Supervisors may have the staff and the time, But employees actually have the skills to make improvement. And what about your residents? They can help you find opportunities for improvement. And how do you monitor and maintain the gains? This is why you really want to have everyone involved. Who's the first person to recognize an improvement? The QAPI at a glance is a guide to help you embed QAPI principles into your systems and services. It will also support the development of your QAPI plan. Included in this QAPI at a glance is a self-assessment. Please complete the assessment and return it to VHQC by May 31st if possible. This assessment will not be shared with anyone, including CMS. It's to help you and us understand your current situation and what areas we may want to focus on later as learning activities, webinars, call sessions, etc. You'll find an electronic copy of the QAPI self-assessment in your handouts. Please use this copy to complete your self-assessment and return by email to VHQC once completed. And it's also posted on the NHIN online community. So let's take a moment to see how a real-life example of performance improvement works. Donna Wilhelm, Director of Nursing at Longview Nursing Home in Manchester, Maryland, will tell us about their success reducing the use of antipsychotics. Donna, it's to you.
Good afternoon, and I'm pleased to be able to participate in this collaborative with all of you, and we're going to talk a little bit about our reduction in the antipsychotics, and certainly was a work in progress and remains a work in progress. Next slide. We've been very fortunate to be able to work diligently to reduce our antipsychotic usage. Quarter 4 of 2014 saw our facility with an 8.9 facility percentile in regards to our antipsychotic use. Now that was putting a team together back in October of 2012. We put a team together which includes, of course, our medical director, our administrator, our director of nursing, the assistant director of nursing, our RN charge of facility nurses on each shift, and then a few of our nursing assistants who had good experience, especially with our dementia patients and behavior patients, and looked at all of our residents as a group who triggered for this report. And then over a period of time, we worked with the physicians and with the families and were able to slowly reduce and eliminate a lot of those medications over a period of time. This coming October will actually be 3 years that we have been a work in progress in this. Next slide. When we talked about overcoming problems along the way, one of the main things that you need to look at when you're developing your team is you must have a champion. You must have a champion on each shift because all of us know that our behaviors occur throughout the day and they sometimes increase in the evening hours and the night hours. And if all of your team members are on your day shift hours and you don't have a champion on your evening and night hours, then you're going to get on-call physicians notified and you may have medications started that are really inappropriate for the situation. So it's very important that you look at your team and make sure you have a champion on each shift so that they can work collaboratively with you and that there's someone that they can call. If they're in a situation where, they're really concerned, what should I do? Should I call the physician for medication? That they have a resource that they can reach out to so that they have some support and direction in that manner. I think the biggest issue with antipsychotics is that for a long time they were utilized with the dementia residents and no one felt that was inappropriate or unacceptable. And in 2013, I believe, CMS came out with the mandates and the educational training hand in hand. describing the terrible dementia resident and the inappropriateness use of antipsychotics in a lot of those residents. Beyond your mental health illnesses, your schizophrenia, your Huntington's disease, your bipolar, there's very limited use of the antipsychotics that truly are appropriate, and certainly not in the use of the dementia resident as a first line of defense for behaviors. So getting people on board with that and re-looking at how you look at things, going through that CMS hand-in-hand training, all those modules, I believe there were 8 modules in that training, and doing it across your shift are a tremendous effort to be able to pull all your team together so that you're on the same wavelength. Next slide. As you can see here on our graph, that in May of 2014, we were actually down to 15.86 in Maryland, and Longview was actually down to about 9%. And you can see as we go along there that we actually got down to 7.61% in October of 2014. At the end of quarter 4 of 2014, our percentage rate was like 8.3%. And it will fluctuate. You can see in June of 2014, it was 9.3 and 9.09 for Longview. And as you get patients who are admitted to you, and they come to you on antipsychotic medication, then you have a new pathway to look at trying to reduce those medications. And you're in a two-way situation. As a rehab facility, if the resident is going home and the stay at our facility is not deemed to be one of necessary long-term care, then you have to determine the risk versus the benefit of trying to reduce the antipsychotic in our situation where you have 24-hour nursing care in comparison to the resident going home and what support services they'll have there. But it is our goal to look at all of our residents within the first 14 days and try to decrease those meds if it is indeed appropriate. But it certainly remains a work in progress, and you cannot let down. I try to explain to my nurses that whatever quality improvement project that we're working on, nurses are notorious for a checklist. We want to check things off. You cannot look at quality improvement in that mindset. It is a continuous circle, and you're always coming back to square one. And if you stop that and you don't come back to square one, that's when I find that you lose your focus and your numbers no longer show or reflect the direction that you want to go in. Next slide. And as I speak with all of you, I'm certainly more than willing to give specifics of things that we've done along the way, if that would be helpful to anyone. But it has been an almost 3-year work in progress, and our goal is to continually decrease those medications and only have them for the mental health residents that truly need them. And I appreciate the opportunity to work with all of you.
Thank you, Donna. And I look forward to learning about your current efforts on the antimicrobial stewardship and antibiograms for antibiotic use. I think that's going to be an exciting and very interesting learning curve for all of us.
It's certainly a necessary one.
Okay. This slide shows you and brings us to advancing excellence. This is a great opportunity for you to align with and work on our 3 aims, which again were systematic QAPI practices, eliminating HAIs and other health-acquired conditions, and dramatically improving resident satisfaction. But the benefit from active participation is not just joining advancing excellence. The campaign provides a selection of goals, and for each goal, the campaign, or Advancing Excellence, provides you tools and resources. Organizational goals include hospitalization, staff stability, consistent assignment, and person-centered care. Clinical goals are pressure ulcers, medications, infections, mobility, and pain management. To be considered an active participant, you choose and report data on at least one organizational goal and one clinical goal. So many choices. What to choose? That brings us to the next slide. And consider this, with CMS's focused efforts on surveying nursing homes, on dementia care, and antipsychotic use, it's a great time to seriously consider advancing excellence medication goals. Just a couple of weeks ago, CMS announced its payroll-based journal, or PBJ system, to, in quote, facilitate your requirement to provide staffing and census information. This begins voluntarily in October 2015 and becomes mandatory in July 2016. So again, advancing excellence staff stability goal may help you prepare. While this slide is up, I want to talk to you about something additional to advancing excellence. We sponsor improvement opportunities like the Long-Term Care Hand Hygiene Collaborative Affinity. This group, led by the Maryland Patient Safety Center, is actually available to both Virginia and Maryland long-term care facilities, and it can help you address your HAIs and hand hygiene issues. And now Erica will tell you more about the benefits of participation and what comes next.
Thank you, Harold, and also thank you, Donna, for sharing your work with us. So, what are the benefits of the Nursing Home Improvement Network? Those are that we provide a flexible, no-cost structure for improvement in the nursing homes. We will help guide the use of quality assurance performance improvement, or rather QAPI tools and resources. We share the latest strategies and techniques from successful colleagues and experts, and we assist with intervention development ideas. And additionally, for you, we support participation in other QI initiatives that you may be involved with. As a commitment to you, NHQCC will prepare data reports and facilitate analysis to support overall quality improvement. In the next couple of weeks, nursing homes who are officially participating with us will begin receiving their nursing home composite score data that we will prepare and send. We will provide consultation by qualified staff and faculty with expertise in quality improvement, share best practices and evidence-based tools and resources to support your quality improvement efforts. We will develop and facilitate collaboration using workshops, affinity groups, which Harold just mentioned, and peer mentoring. And finally, provide you with expertise and practical assistance. So in terms of next steps, where do we go from here? Next steps for this collaborative, for this first collaborative of the Maryland Virginia Nursing Home Improvement Network, are for you to take a moment to do these steps on this slide, which are to sign up for the Nursing Home Improvement Network online community and to post a team photo. Those are just really important to us. We love to see your smiling faces and to put names and faces together. To submit the Nursing Home Improvement Network team and goals form to the HQC. This form was included with your handout for today's call. If you didn't see that, there was an email that went out earlier this morning with those items attached. If you scroll down, you'll see the links to get to those items. We're asking that everyone complete and submit a QAPI self-assessment. The self-assessment can be found on our online community. It can be found at cms.gov. And additionally, it was also included in the handouts that we provided this morning. We're asking if that can be done, take a first stab at it by the end of May. That would be great. And if you need assistance, we can certainly help you understand that form if needed. We're asking for participants to sign on to the Advancing Excellence and to give VHQC access to your aggregated data submission. That will help us with gauging measures that aren't captured by the nursing home composite score measure. Additionally, just asking that you participate in upcoming events as outlined in the grid earlier, and also that will be posted on the Nursing Home Improvement Network online community. We will be sure to be in communication with you, and actually that's why that team form is so important, because we do ask for email addresses of everyone on the team, and that's so that we don't get bottlenecked and only one person gets the email. We want to make sure that the entire team is receiving that information. And for these items, we ask that you submit them to the email address at the bottom of the slide, or to fax them to that number. Contact information for our improvement consultants are listed here. Harold Hansen and David Hall are shown on the slide. My information is at the second slide in the deck, so feel free to contact any of us for further information or for questions. And finally, we appreciate your time and your attention for today's webinar. Don't leave us just yet. We just want to point out that any questions that are received in chat or any questions that we can't answer, we will certainly do that for you. As shared in our webinar invitation and in the theme for our first collaborative together, improving nursing home care is a marathon, not a sprint. Achieving lasting results requires commitment, training, and the support of a dedicated team. And the result, better care for residents and families, is well worth the effort. At this time, we will take questions via chat or on the phone. Wes, can you please remind participants of how to ask a question?
Certainly, the floor is open to your questions. If you have a question or comment, please press 7 on your telephone keypad.
While we're waiting for questions, I would just like to remind you to please take a moment to answer the webinar evaluation questions that are now posted on the right-hand side of your WebEx. Your answers will help us to better serve you, and we really appreciate the feedback. Do we have any questions that have come up?
At this time, there are no questions.
Okay. Well, if anybody has a question, please feel free to ask or to jump in the chat. But just as a side, I'm just really, again, pleased to have our expert faculty, Sonia Varsnes, with us today here in the room. And you may already know that Sonia was the co-developer of the hand-in-hand training series for nursing homes that speaks to dementia in nursing facilities. And I'm just thrilled to have her here with us. And I just wanted to see, Sonia, if you wouldn't mind just sharing a couple of words about your work with our participants.
Sure. I'm thrilled to be here, and I thank each and every one of you for your commitment to improving care for people who live and stay in nursing homes, but also for the staff and for your team members. I'm really looking forward to adding more resources to your toolkit and your efforts. And from my perspective, I hope to really provide information and reports in using person-centered approaches to address your goals, and particularly in reducing the use of antipsychotics and improving the quality of care for people with dementia, but I would say even more importantly for improving well-being for people with dementia and for their families. But importantly, that person-centered care is really not just good for residents, it's good for staff as well. And that it does take a village to succeed. So thank you for allowing me to be here and to be a part of this great project. Thank you.
Thank you, Sonia. Let me check one more time. Do we have any questions to come into chat? I'm sorry, to go over the queue.
At this time, there are no questions over the phone.
Okay. Well, we again appreciate everyone's attention and attendance at this webinar. We know we all have quite the road ahead, but we are excited about the opportunity to be a support to you. We will be in touch shortly and with everyone, and again, if everyone could be reminded to go back to the slide of next steps and start working on those items. That would be wonderful. And with that, I think we can end now. You have a whole half hour, or rather 40 minutes back into your day. We hope that this webinar has been helpful to you, and thank you again. This concludes our webinar. Have a good day.
Thank you. This concludes today's teleconference. We appreciate your participation. You may now disconnect your lines at this time.